Hi, my name is Atiqa and I am from Group 23. My topic for today will be about the Trendelenburg position in nursing surgery for patients. So what is the Trendelenburg position? It is a position for a patient on the operating table, most commonly used during lower abdominal surgeries and central venous catheter placement. Some description about this position. In Trendelenburg position, the patient is supine on the table with their head declined below their feet at an angle of roughly 16 degrees. The degree of Trendelenburg should be minimized as much as possible, and if possible, the patient should be repositioned into the supine or reverse Trendelenburg position at established intervals. Due to the angle, the Trendelenburg position allows for the patient's abdominal organ to move towards the head by the use of gravity, improving surgical access to the pelvic organs. This is another version of the Trendelenburg position, which is the steep Trendelenburg, in which the patient is angled at around 30 to 40 degrees in the head down position. Most often, this position is used for robotic pelvic procedures, and there are some risks associated with such position, for example, altered pulmonary function, airway edema, increased intracranial and intraocular pressure, and also nerve injury. So these are the types of Trendelenburg position, apart from the steep position. So there's the general Trendelenburg position, in which the patient's head is positioned down and feet positioned up, as you can see the picture displayed on the left, and the opposite of the general Trendelenburg position, which is the reverse Trendelenburg, in which the head is up and the feet are positioned down. And this position is used for laparoscopic surgeries, including gallbladder, biliary tract, and stomach procedures, as well as head and neck surgeries, as shown in the picture on the right. So I've prepared a quick demonstration in which there's a paid actor, which is my shark, Chompy the shark. Here with me today is Chompy the shark, and we will show all of you a quick demonstration on the types of Trendelenburg position for patients. So imagine this as the operating table, and the patient, Chompy in this case, will be lying on their back like this. And before adjusting the position of the operating table, we have to make sure the patient's upper and lower limbs are secured to the operating table. There will be areas for securing them. Otherwise, the patient will get injured if you're not doing it correctly. So for the first position is the general Trendelenburg position. It is when the patient's head is slanted at an angle of 16 degrees below the level of their feet. It's not really much of a big angle because of certain reasons, which will be explained after the demonstration. And another variation of the general Trendelenburg position, which is still the same position, but it's the angle of slanting of the head is bigger than the general Trendelenburg position. So this is called the steep Trendelenburg. As you can see, the angle is much greater than the general Trendelenburg position. It's about 30 to 40 degrees of slanting. And the last of them all is the opposite of the general Trendelenburg position, which is called the reversed Trendelenburg. So instead of the head going down and the feet rising up like the Trendelenburg position, as so, the reversed version is the head going up and the feet going down at about the same angle as the general Trendelenburg, around 13 degrees. Now we have covered the quick demonstration on the Trendelenburg positions. Next is what we have to consider for such position. So we have to consider brachial plexus neuropathy, in which the approximation of the clavicle and first rib will threaten the compression of the subclavian vessels and brachial plexuses. We also have to consider shoulder braces, which are causal to brachial plexus neuropathy. This is because the gravity pulls the patient's weight against shoulder braces and thus causes the shoulders to yield to pressure and body mass will slide between the braces. Next criteria we have to also consider is the perioperative complications from extreme positioning. So long period of time may lead to a risk in various injuries, including ocular trauma due to increased blood pressure in the head, as well as corneal abrasion, retinal detachment, and ischemic optic neuropathy, and it also involves respiratory distress. So as a conclusion for Trendelenburg positioning a patient for a surgical procedure involves reducing risk of injury and increasing comfort. This position, Trendelenburg, allows a surgeon greater access to pelvic organs, and it's also helpful for procedures like colorectal, gynecological, and genitourinary surgery. As with all surgical positions, risks must be assessed prior to positioning a patient in this position. For example, risks to a patient while in Trendelenburg include diminished lung capacity, tidal volume and pulmonary compliance, venous pulling toward the patient's head, and sliding and shearing. And lastly, Trendelenburg position should be avoided for extremely obese patients due to differences in pressure.